Good afternoon, everyone, and thank you for joining the May General Thoracic Surgery Database webinar. First and foremost, we want to thank you for joining today's call. We hope you, your coworkers, friends, family, and loved ones are all staying safe and healthy during this time. And again, thank you for all that you do. On the call today from the STS, we have myself, Leanne Jones, Database Manager for the Thoracic and Congenital Databases, Carol Crone, Senior Clinical Manager for the STS National Databases, Emily Conrad, STS Senior Database Coordinator, Donna McDonald, Director of Quality, and Jane Hahn, Associate Director of Quality. We also have our IQVIA colleagues, Melanie Bent and Jeanette Hanna on the call as well. They'll be presenting the IQVIA update today. I'm going to run through the agenda real quick as we have a lot of info to cover today. We will touch on a few housekeeping updates. I'll cover some important dates for the thoracic database. Emily will provide you with an AQO update. We'll review the new COVID-19 variables, and we will finish up with the IQVIA update and the Q&A. For our housekeeping items, the May training manual has been updated and posted. The newly updated again, sorry for having to update those yet again. 241 data collection forms have been posted to the website and they are available for download. These updated forms, as well as the training manual, include both of the new COVID-19 variables. For the data version 5.21 update, the STS and General Thoracic Task Force are currently working on the data version upgrade. STS and Task Force members have been holding weekly calls to work through the upgrade. In addition to these calls, the STS staff has presented the DCF changes to the core group for comments and suggestions, and we are currently finalizing the data collection form and preparing for beta testing of the DCF by the core group within the next couple of weeks. At this time, we are still on track to have the data specs to vendors in July with a go-live of January 1, 2021. Next up, we have some important dates for General Thoracic. We have today's monthly webinar today, May 13th. On May 27th, mark your calendars as we have the General Thoracic User Group call scheduled for 2 p.m. Central. On June the 10th, we will have our next General Thoracic monthly webinar at 1:30 p.m. Central. For summer 2020, we are expecting to release the spring 2020 harvest risk-adjusted results. They will be available on the dashboard, and this will, as you are aware, covers procedures up through 12/31/2019. On September 18th, the fall 2020 harvest, which is currently underway, is set to close, and that harvest is accepting procedures up through June 30th of 2020. And then on January 1, 2021, we are set at this time for go live for the version 5.21 data spec upgrade. Next, I'll turn things over to Emily Conrad, the STS Senior Database Coordinator, for our STS AQO update. Emily?
Hey guys, thanks for letting me speak about AQO today, which is very exciting. If you have not attended our meeting before, what is AQO? It stands for Advances in Quality and Outcomes, a Data Managers Meeting. We typically go all around. Last year we were in New Orleans, but this year with our challenges with COVID-19, it is going to be a virtual meeting, which is exciting. I think that we're going to be able to have a lot of creativity and innovation in how the meeting will look. So this year, each database will have its own day. It's going to be from Tuesday, September 29th through Friday, October 2nd. General thoracic content will be on Wednesday, September the 30th. Currently, we are looking into different platforms with our education team. We should be, for the platform, we're looking at a wide variety of functions, such as live stream talks, pre-recorded material. We're going to have a capability to be able to have Q&A through chat boards or panel discussion live with our surgeons and data manager speakers. We're also going to have e-posters this year, and then also exhibit time. With the e-posters, I just wanted to let you know that we should be launching our abstract submission soon. So be thinking of quality improvement projects that you might possibly want to submit as an abstract. As for pricing, we should know that within the next month. That is a discussion that is being had with STS staff currently. So there will be vendor engagement and engagement with our speakers. We're really looking forward to it. That's about it.
Great. Thank you, Emily.
Yeah.
All right. Next, we'll jump into the COVID-19 update. As you're aware, STS has added 2 new fields in order to collect data on COVID-19 patients. STS has activated the use of the temporary coded field sequence number 4080. And most recently, we've added the temporary date field sequence number, sequence number 4070. Sequence number 4080 is now being used to answer the question, did the patient have a laboratory confirmed diagnosis of COVID-19? And the temporary date field sequence number 4070 was added to capture the date of positive COVID-19 test closest to the OR date. In terms of abstracting the COVID-19 fields, we must be a positive PCR test. Antibody testing is not being captured. Again, we're just looking for a positive PCR test. For more than one positive test, we ask that you collect the test closest to the OR date. The positive testing field, the testing field should begin data collection as of April the 1st. And then we are asking participants to collect the date of the positive test, beginning with May 1 cases. Obviously, sites can retroactively collect these fields back to January 1, but you are not required to do so. And as always, before submitting your questions, your COVID-19 questions, please check the training manual to see if your questions have already been answered. The May training manual that is currently posted does have some FAQs currently, and they're now related to a lot of the COVID-19 questions that we've been getting. I also wanted to review how to capture PFTs, as we are still getting a few questions. Please note this info, again, it was added to the May update in the training manual that is currently posted, but we are aware that PFTs are more difficult to obtain at the present time due to either labs being closed or due to minimizing patient exposure to the hospitals and clinics. So the STS National Database Surgeon Leadership and Task Force is aware of the issue, and missing PFTs will be taken into account. Programs will not be penalized for not obtaining PFTs during this challenging time. And right now we're asking that participants please code this variable, the sequence number 910 PFT, as no, the PFTs were not performed. And for sequence number 920, as a reason why not performed, please indicate patient unable to perform. And again, that information is in the training manual, so you can refer back to that May training manual that is currently posted for more information. And I'm including this slide again. We've seen this before, but I did want to include again for any of those that may have not been able to join our previous webinar. Again, why was this field added? Sites have reported that patients who are found to be COVID-19 positive are having worse surgical outcomes. You do not have to go back to January 1 to collect this variable. Again, we're asking for the testing variable to be collected as of April 1 and the date as of May 1. But again, you can go back to January 1 if your site was impacted early on. Will these patients be included in outcomes? And again, STS is in discussion regarding how these cases will be handled. We need to get the data in first to see its impact. Surgeon leadership is working on a plan as to how this data will be handled in analysis. That plan has not been finalized yet, but once STS leadership does have that plan finalized, please know that will be shared with participants. And again, we will have more information. Oops, sorry about that. I didn't mean to advance that slide. We will have more information again once that plan is finalized, and STS will share that with all database participants. Can I abstract a patient who is assumed to be COVID-19 positive but was not tested? No, the answer to that, we're not doing any assumptions. Only code yes for a patient who has been confirmed to have COVID-19 through PCR laboratory testing. And another question that we've gotten, COVID-19 after discharge for patients that self-report. For patients that self-report testing positive for COVID-19 within 30 days of surgery, indicate yes after discharge within 30 days of surgery. Next, we will turn things over to Melanie Bent and Jeanette Hanna for our IQVIA update. Melanie?
Thanks, Leanne. And hello, everyone. Let's go ahead and let's take a look at a couple of updates that have been applied to the system and some new updates that are coming. And we also want to share a new report that we will be developing. So first thing in regards to what's new within the platform is a new feature that is what we call the automatic record removal detection feature. And what it will do is it will use the surgery date ranges to determine whether or not a record that was already submitted, if it was removed from the source vendor system, if it was removed, once you re-upload that file, the system is going to be able to automatically determine that the file was not included and take the step to remove it from the IQVIA database. And so basically, this will keep consistency in regards to the records that you're submitting. If you did, for some reason, need to remove that record within your source system and needed to also remove it within the IQVIA platform, this functionality will allow you to keep those records in sync. And so, the system is looking at, again, the minimum surgery date and maximum surgery date. So it looks at a range based on that uploaded file. And we're going to walk through just at a high level and give you a visual of how that works. Let's go ahead and go to the next slide. All right, so the assumption here is that the user has already uploaded a file to the IQVIA platform for the surgery date range, and this example is for August the 1st, 2019, which is your minimum date, through August the 5th, 2019, which is your maximum date. And so those records were already in the system in the IQVIA platform, and now a subsequent upload is being done for that same reporting period, for that surgery time period. And so when that secondary upload is occurring, the system is going to look to see if the record already exists. If it already exists and it's in the original source, in that file that you're uploading, it's going to process that file. As you can see here with record A, it's available within that submission. It sees that it already is available within our database, makes that match, and basically just confirms that record is in the system. And so it just passes it through. But you'll notice that there is a record B and C, right, that was already loaded into the system, but in the uploaded file that you're now submitting, they do not appear in the actual submission set. And so it's identified at that point, and there are other IDs that it matches against, such as it looks at the participant ID, it looks at the patient ID, it looks at the record ID. And so it determines that the record is not there, therefore it will go ahead and do that automatic removal. And so that's where you see in the post-load step, B and C is no longer there. Then it also recognizes that there is a new record, which in this instance is E. And so it picks up that E is a new record, it processes that, and it pushes it through. And so that new record is then added into the system. So a question that we've gotten in the past is, well, what if we basically put the record back into our source system? Will that of course, update the IQVIA system. And yes, it will. If you re-add that record in your source system and you follow the same steps of exporting and it's included, then it will be re-added to the IQVIA platform. So just wanted to also call that out. Next slide. And here is just another, just again, a recap of the workflow. Just wanted to add this additional step since we do, the STS provides this information, to the website. Just wanted to make sure that these steps are also included here for review. So this will be available within the slide set. So just reviews what I just talked through. So let's go to the next slide. Another feature that's been added recently is in regards to the uploader record processing improvements. And so these processing improvements have benefited users where the processing time has the performance has basically decreased the amount of time of how would I say, it decreases the time limit in regards to the validations that are executed against the records. And so what I mean is, in this instance, when the system is processing those case records, it is looking to see if those records are already in the system and if there are any changes to those records. If there are changes to the records, then it will perform any kind of validation updates to those records. If there are no changes to the records and everything stays the same, those records are skipped. And so this will allow the processing to move in a more efficient manner and will allow you to focus on those records that have been updated or added. And so let's go to the next slide and we can talk through some of the updates that will happen because of this. So the validation, as I stated before, will only execute against those newly inserted records or updated records within that data set that you're uploading. And so the system will only display in these examples the record count for the items that were updated. So there will be a change to the actual uploader card that you currently view. And so when you take a look at the record that you're uploading, let's say that you have 100 records that are in that data set. Within that data set, you may have had 50 records that were changed or potentially added to. Those are the records that are going to show up within this count. So that is a change in what you're seeing. But we will show you the total number of records that were included in your data set. We will show you that on the data quality report. So you will be able to validate that you had 100 records and those 100 records were indeed processed within the update. But again, the card is only going to show you those records that had actual changes or were added. Let's go to the next slide. And so this is basically just talking about those changes, seeing a difference in the number on the upload history card. And so when you are seeing that process and those results, just know that the number that is displaying is basically showing you the number of records that actually had changes and where the validations executed against. So one of the things that in the meantime, because there is a new report that's coming and that we want to be able to get for you to be able to see that there is something that's coming, and this is something that I think some questions may come around, well, how are we able to see a total view of the records in the current state within the database. And so Jeanette is actually going to share the details regarding that new report. But in the meantime, if you are wanting to take a look at previous records that had validations, you will need to take a look at a previous submission, so a previous historical card, to be able to review those data quality reports to see the validations that triggered on those previous records. But again, we have a new report that we want to share with you in regards to getting more details in regards to the validations on all of your record set, or depending on the time frame that you're looking for, going to be able to see that too. Let's go to the next slide. And so I did say that on the data quality report, you'll be able to see a total number of records to validate that within the data set that you've uploaded, that you will see the total number that was included in the submission. And so if you look at this screenshot, it does show the entry where it will give you the total number on the very first row of the data quality report, the total number of records, and then all of the additional records that were actually processed. You'll see individual line items underneath that. Okay, so you will see a view of those records there. And so that first entry is going to show the result of the record has not changed. It's going to give you the record ID, and it will give you a summary of all of those records that have no changes. It will give you that information on the DQR. Okay, let's go to the next slide. And so the next thing that, before getting to the report, the next thing that I wanted to cover with you are that we will have updates to the system that will be happening within the May timeframe. One of the items that we have been asked to review, and we are moving forward with getting this implemented, is making sure that we're giving you the capability to filter out those messages that says that there are duplicates that have been identified. We had gotten feedback that it basically just added a lot more to the report in regards to noise, and if there was a way to filter those out. We are now giving you that filter to remove those or hide those on the report. Another thing that was a high ticket item was being able to split out the record ID and patient ID from the message content. So that message description, it always had the IDs in the very beginning of the message. So that we actually have updated, and we will be deploying this to the production environment within May. And we will be taking the IDs out and putting them in the respective columns. So you have a column for record ID, you have a column for patient ID. Now you will just see those in the respective columns and just the message content within that column. Other items that we will be addressing are listed here too. We had an issue that was reported regarding race documented that will be resolved this month. And then also we're updating the application to abide with the requirement that came through for the COVID-19 regarding using the temp code and temp date fields. We will be making those specific for the COVID-19 data variables for collection. And then we do have items related to the missing variable report. We will be making updates to that report. And so those will also be going in for the month of May. So I know I flew through this, but I want to make sure that I can get to the big piece, which is the new report. So if we can go to the next slide, and I will turn this over to Jeanette.
Thanks, Melanie. This is Jeanette. Just a comment on the update we are making for the COVID variables. You can be submitting those now using the temp fields. The change that we're making is just sort of a label change. So where it shows, it'll look more specific to COVID, not just the temp labels. So please do continue using those fields in your submissions without waiting for this update.
Thanks for clarifying that,
Yes, thank you.
Yeah, thank you.
So the if you want to jump to the next slide. So I did want to give you an overview of the harvest summary report. So what Melanie was describing with regards to the changes that we've made on the uploader, we do continue to get feedback that there's there's a lot of validations and there's a lot of messages in the DQR, and we have received from some very strong perspectives asking for reductions in that wherever possible. So to that end, the DQR will be focusing on the records that actually have changes in the most recent submission. But we do want you to be able to see sort of what's the status of your harvest data set right now, without needing to look at each submission in turn. So to that end, we are working on this harvest summary report. It would be a new report that would be accessed from the operational report spot near where you get to your MVR and dashboards. So over there, you would have this option to go in and open the new report, and you would pick your date range. So if you wanted to pick your full harvest date range, that's fine. If you wanted to focus on, say, a particular month where you're maybe focusing your review, you could do that too. And then it would return a summary of all the records that are there in the data set with their current status of validation. So, even if you had submitted the same record 20 times with updates each time, this report will show you your error and warning status based on the current state in the database. So effectively the last time it was submitted. So it would show you, the pie chart in the upper left would show wedge for any records that had no validations outstanding. So errors or warnings, nothing was outstanding. And then counts where the, because we do advise that you be reviewing your error validations and working to address those. And then, the warnings are on a slightly lesser severity. So from a focus perspective, you really want to be able to see which ones have one or more errors. So we'd have that in a pie. And then also the warnings. So the view in the upper right would show, based on the record ID and the patient, it would show a count of the errors and warnings outstanding for each record. And this is similar to what you see in the DQR right now, but the DQR will show you this information per submission, whereas this would do it across any number of submissions, but it's based on what the current status is within the data set. And then just like you can with the DQR, you could select sort of a collection of the messages or the records in the upper right, and then you would see the same message level detail that we see in the DQR, and we will have the same sort of split out with the short name and the record ID so that those are searchable columns or sortable columns. Just the same sort of feedback we've gotten on the DQR itself. Next slide. I think that's everything.
Yep. Yep, thank you, Jeanette. Thank you, Melanie. Next, many of you guys have seen this before, the STS IQVIA support plan. Again, we're just providing this for your convenience, and it is available out on the STS website as well as within the IQVIA platform. As many of you are aware, once you call in or email your questions, that goes to IQVIA customer support. You can use the phone number listed here or the email, and you will be connected to IQVIA Tier 1 support. If IQVIA Tier 1 support is unable to answer your question, they will route your question either to IQVIA Tier 2 support based on the question, or they will route your question to STS directly. From Tier 2 and STS, if STS is unable to answer questions regarding data analyses or whatnot, we will route that question to DCRI for a response. And if IQVIA Tier 2 is unable to answer the specific question, then that will be routed If it has to do with your vendor software, that question will be routed directly to your database vendor. So Tier 2 will work directly with your vendor, and STS will work directly with DCRI to get responses to questions as needed. And again, this IQVIA support plan is available out on the STS website. Yes, ma'am.
Hey, Leanne, it's Carol. I just want to verify that the questions regarding the database vendors, if you know at your site that it's a question for your vendor, please reach out to them first. If you're not sure, feel free to reach out using the IQVIA support plan, and we could help figure it out for you too. If it needs to, if it's IQVIA related or STS or database vendor or DCRI related, we could assist with that. But if you're certain that it's a vendor issue, please reach out to them first. I just wanted to clarify. Thank you.
So perfect. Thank you. It's very important. Our next slide here is just the resources that you have available. You are aware you have the STS National Database webpage that has a lot of valuable information in your resources. You have STS tech support at IQVIA. If you need assistance with the uploader, data quality report, missing variable report, dashboard, or any password or login issues, you would obviously go through STS tech support for assistance. And there's the phone support number as well. There's also an STS National Database feedback form out on the STS website. We encourage you to use this form for any feedback, positive or negative. Anything we can do to help enhance your experience with the transition, things we're doing well, things you think might need a little bit of work. We're always looking for ways to improve, so please share your feedback with us. We would love to hear from you. And as well, here is a listing of resource documents that are available out on the STS website. And always my email address is here listed at the bottom. Please feel free to reach out to me anytime with any questions, comments. If you need anything, please do not hesitate to contact me directly. Our next General Thoracic Surgery Database webinars, please mark your calendars. The user group call is scheduled for May 27th at 2 p.m. Central Time, and our next monthly webinar is scheduled for June 10th at 1:30 Central Time. And again, here is my contact information. I'll put this slide back up while we go through Q&A. Again, feel free to contact me directly with any questions or concerns. If you have any database operational questions, such as access to the platform, or any general database operational questions that deal with your contracts or contacts, please email us at stsdb@sts.org. Next, we are actually going to go to our open discussion. Please use the Q&A function. We'll be sure to answer as many questions as possible. And please know that we do encourage your feedback and would love to hear from you. Actually, before we jump into the Q&A, Jane wanted to give an update. I know at times many of the participants, we hear that you all have trouble getting our emails through our STS email boxes. So STS does have the opportunity now to have a secondary email for participants. So I was going to turn that over to Jane to let her give a little update on that availability. Jane?
Great. Thank you, Leanne. As Leanne was stating, hi everyone. As Leanne was stating, we now have the ability to store a secondary email for each of our data managers and other users. So I know that on the adult cardiac side, some folks have decided to add their personal email as their secondary email in our records. And going forward, what STS will do for all email blasts will be pulling both primary and secondary. So if you'd like to include or add on to your record within STS your personal email address as your secondary, we're happy to take those for you. And hopefully between your personal email and your institution's email, you'll receive our email blast going forward. If you wouldn't mind just sending your request over to the STSDB inbox that Leanne had posted on her last slide. I think she'll show it during the Q&A. We'd be happy to make updates to your records accordingly. Thanks.
Thank you, Jane. And I put that contact information slide back up for those that need to email us with a secondary email. So again, it's stsdb@sts.org. So next we're going to turn things over to Q&A. So we've got some questions, so we'll get started with our questions. Our first one, what does not penalized for missing PFTs mean? Does it mean that the procedure will still be used in the analysis denominator? This is actually still currently under discussion. Again, we don't have a final plan yet. The task force members and the surgeon leaders need to see the data as it's coming in to determine how that data is actually going to be handled in analysis. So I don't want to assume and tell you that it will still be included in the denominator, as I honestly, I don't know at this time. So once surgeon leadership does have a final plan, we will share that with participants. So I wish I could give you a little bit more information, but Donna or Carol, do you have anything you'd like to add to that?
This is Carol Leanne. No, I think we just know that it's really difficult, and we don't want to bring patients in and expose both patients or respiratory techs who are providing, who are performing the PFTs to a potential exposure. So the surgeons are being extremely sensitive to that, and as we get more data in or as things progress, they would be able to make a better decision about how we would move forward with that. So I think you got it right on the head. All right.
Yep.
Thank you. Thank you, Carol. Thanks, Donna. All right, our next question. When can we expect the national report to be published? We are looking to have the spring 2020 harvest results published this summer. So I don't have an exact month. So we are expecting to have those results published this summer on the dashboard. We are working with DCRI and IQVIA to that data exchange. So we are working, and as this is a new transition, a new thing for all of us, the harvest results are, delayed a little bit, but as we get this process down and get everything established, moving forward, results will be available in a more timely fashion. So thank you for your patience as we work through this. And again, these results will be published this summer. So thank you. Our next question, I think, Melanie, this is a question for IQVIA. When upload only changes 5 records, will data of missingness from those with no change still populate?
Yes, those will still populate. The calculations for the MBR is looking directly at the cases to determine fields that are missing. So if those fields are still missing even after you upload, the report will pick that up and still present those to you.
Thank you. It looks like our next 2 questions are kind of related. Can you please repeat the info about the race documented issue? And then the following question was, will we have to re-upload records who had the race documented issue?
So for the first item related to the race documented, so that one is it's STS 2252 is the ID, and that is going to be an item that we will be pushing a fix to this month. Once items or fixes have been deployed to the environment, we will be posting a notification within the application, and also, because I know we may have vendors on also, a summary will be sent. We do have a distribution list for the vendors, so we'll be sharing that also when the updates are applied. In regards to the secondary question, if you need to upload those records again, you do not. The message basically was appearing, and it should not have been triggering in some instances, but it did not change the data. Your data at this point is correct. So you will not have to re-upload your records.
Thank you, Melanie. Our next question, what is the temporary code sequence number for the date of positive COVID? So that the temporary date is sequence number 4070, and then the positive test is sequence number 4080. Again, it's 4080 for the test, and for the date, field temporary date, it's 4070. Our next question, would you please redisplay the thoracic timeline slide shown? Claudette, I have that up on the screen now, and also these slides will be available out on the STS website for download as well. So again, the slide deck will be available in PDF format after, probably within the next day or 2, will be posted on the STS website for download. Our next question, in minor non-analyzed cases, we are not required to complete the full database form. Can you please remove all the warnings and errors that are not required to abstract or fill in non-analyzed cases?
So, and this is Melanie. So we allow, so the validations will run against all cases. So you're going, anything coming into the database, you will receive validations. And so a part of the report is the filtering capability. So if you do not need to address those cases that are minor, then you can deselect to on the report, and that basically would filter out those cases, and you would just focus on your major cases. But that's what the filtering comes in. So any case that comes in, validations will execute. That's just by default. But if you do not need to address those cases, just use the filtering, and then that would basically just allow you to focus on your major cases.
Great, thank you, Melanie. Our next question, we have some AQO related questions. Will AQO be virtual beyond 2020? And at this time, we plan for AQO to be live again in 2021. Has a price been established for AQO? Price has not been established yet, but registration will be announced through a standalone email, and information will be posted on the STS website as soon as possible. And where can we sign up for AQO since it will be virtual? Registration will be open this summer. You can find AQO information. Actually, we'll put the link in the chat box for everyone out on the STS website. Carol, do you mind putting that link in the chat box for the attendees? And you can find all the AQO information at that out on the STS website.
Yep, I'm on it now. I'll get it in 1 second.
Oh, thank you. Let's see here. Our next question, general thoracic AQO date will be 9/30. What are the dates for adult cardiac and congenital? So here's the schedule. Tuesday, September the 29th will be Intermax and PediMax. Wednesday, September the 30th will be general thoracic. Thursday, October the 1st will be adult cardiac. And Friday, October the 2nd will be congenital. All right. And then our next question, oh, thank you. And Carol has posted the link regarding the AQO into the chat box. So thank you, Carol. Our next question, what did you do with the secondary diagnosis being an error? And I don't know if that's...
I cannot remember.
Yeah, I don't know if that's...
That was an issue, but that was resolved.
Yeah.
If that's something that you're still encountering, then please, and if you don't have a ticket already logged, but that was a previous issue where I believe certain diagnosis codes were flagging validation. But at this moment in time, I'm not remembering the specific issue. But if you are experiencing an item where you need assistance, please contact our support team, and then we can go ahead and take a look at what you're referring to.
Thank you, Melanie. Actually, we've gone through all the questions. I'm going to give everyone an opportunity. If you have any additional questions, if you want to go ahead and get those into the Q&A, we'll be happy to answer them for you. If you do not have any questions at this time, or if you have any questions later on, or if you're not comfortable putting your question in the Q&A, please don't hesitate to email me directly. My email address is up on the screen. It's ljones@sts.org. And again, I'm happy to answer any questions, or you can feel free to give me a call directly to chat, and I'm happy to talk with you about anything. My number is 312-202-5822. I'm not seeing any additional questions come in. Carol, do you have anything you'd like to add, or anything I may have overlooked, missed?
No, I think covered everything really well, Leanne. If there's any questions, please submit them. Otherwise, it looks good.
Yeah. but I'm not seeing any additional
I guess
questions
it's
come in. So
maybe
yes, go ahead.
maybe just to reiterate the importance of what Melanie had presented on the upload of files, that if there were no changes to those files, that the counts would look different than what you're expecting to see. We did get quite a few questions after that happened with adult cardiac, and we presented it, and I don't know that everybody was able to digest what was presented. So maybe just reiterating that that is something that will happen. It's expected to happen if you submit a file with 200 records and only 40 of those records had changes. What you'll see in the uploader is 40 out of 40 if all of those files were accepted back in that had changes in there. And then you would have to go into the dashboard and use your filters to see that whole time frame for all of those records. I think that was probably the biggest change that we've had within the last couple weeks that may cause a little bit of confusion. So your numerator denominator will look different and will look unexpected. It'll be an unexpected number to you. So if you have any questions when you're going through that, feel free to reach out. But I would just be aware that that is something that's happening, and it's not an error, that's supposed to be happening to kind of improve the feedback and improve your speed of submitting files. I think that's just the only thing I would really highlight from today's webinar.
Right.
Yeah.
Thank you. And always, if you have any ideas or suggestions on improvements and enhancements, any type of future reports you would like to see, please, share that with us. We want to make this dashboard and these reports useful for you. So please, let us know what you want, what you need, and we'll work to make this dashboard useful for you. So again, please don't hesitate to give us your comments and your suggestions and your ideas. We'd love to hear them. So we'd love your feedback. So feel free to, again, email me directly, and you can also feel free to use the STS database feedback form that's out on the STS website. I'm still not seeing any questions come in, so I guess we'll go ahead and cut it a little early today. Thank you, everyone, for joining today's webinar. Again, go ahead and mark your calendars. We look forward to you joining our user group call on May 27th at 2 o'clock Central, and our next monthly webinar, June 10th at 1:30 Central. So thank you, everyone, for joining today, and I hope you all have a great week and a great weekend. Stay safe. Thank you, everyone.